likely to be viewed with suspicion. In reality, the majority, some 70 to 80%, of hospitalized mental patients can recover and live relatively normal lives if their treatment has been adequate and received in time. Even many, perhaps 25%, schizophrenics, whose illness is probably the most debilitating and devastating, can eventually recover. 50% of schizophrenics show improvement in their symptoms throughout a 10-year time period. Torrey, 2006, Insel, 2015. According to studies in the United States and Europe, about half of all schizophrenics spontaneously get better over the course of 20 years, and professional treatment with support from family and friends further makes the recovery easier and faster. Buffy, 1986, Kapelowicz and Bitter, 1992. The third popular belief is that there is a sharp, clear distinction between mentally ill and mentally healthy. This is widely taken for granted, but it is true only if we compare the extremely few mentally ill persons who are extraordinarily disturbed with average normal people. Most of the time, even a psychiatrist cannot clearly differentiate the vast majority of the mentally ill from the mentally healthy. Thus, the dividing line between mental health and illness is mostly arbitrary. APA, 2013, Bialik, 2011, Brody, 1997. The fourth popular belief is that the mentally ill are mostly crazed or violent, as often portrayed in news media, movies, and television programs. The overwhelming majority of mental patients are not prone to violence and criminality. Only about 7% of crimes can be directly attributed to mental illness. Peterson et al., 2014, with approximately 3% attributed to symptoms of major depression disorders and 4% to symptoms of schizophrenia disorder. People who are mentally ill are more likely to engage in behavior harmful to themselves than behavior that harms others. Most significant, they are much more likely than those not suffering from mental disorders to become victims of violent crime. Johnson et al., 2016. The fifth popular belief is about midwinter depression, which psychiatrists may call seasonal affective disorder. Many people assume that we are likely to become in the middle of winter,